Good evening and welcome to Providers of Adolescent Services, What to Expect After Enrolling in the California COVID-19 Vaccination Program. I am your moderator for the evening, Leslie Amani, and we welcome you to the California Department of Public Health's webinar this evening. It is Tuesday, May 25th, and we will be spending the next hour together to learn more about becoming a pediatric provider and adolescent service provider. Next slide, please. As we are looking ahead, some housekeeping items that you attendees should be aware of. Your lines are automatically muted when you join the call. You may access today's slides at eziz.org/COVID. You can use those during the webinar this evening and you can download them and follow along. And then this session is being recorded and it will be posted there after the event as well. If you look into your handout section as well in GoToWebinar, you can also download the slides for adolescent providers available there linked. So please feel free to do that as well. We will have a question and answer period, so please use the questions pane to ask a question. And if you're having any issues with this evening's webinar, there is troubleshooting help available live by calling the CMA membership team at 800-786-4262. Next slide. That Q&A panel. So we want you guys to be sure you know right where it is. Please look for the question icon and you can submit questions via GoToWebinar questions pane. It says ask the staff a question, submit your question, and it will be received by our panelists and team of subject matter experts. Next slide, please. So our objectives this evening. By the time we finish, we hope that you are able to describe clinical guidance for vaccinating adolescents with COVID-19 vaccine, provide operational guidance and considerations for vaccinating adolescents with COVID-19 vaccine, describe storage and handling requirements for participation in the California COVID-19 vaccination program, and share resources for providers and patients. Next slide, please. Our agenda this evening includes clinical guidance on use of COVID-19 vaccine in adolescents from Dr. Tom Bu, next steps after enrollment from Nisha Gandhi, storage and handling of Pfizer COVID-19 vaccine from Kate McHugh, next steps after ordering vaccine from Claudia Aguiluz, billing and reimbursement from Mark Lane, a My Turn overview from Eric Norton. We'll cover resources that are available and we'll have our question and answer period. Next slide, please. So it's very important that you offer your feedback and we really value what you have to say post-webinar. So when we finish, a short survey will automatically launch in your web browser once we close out of the webinar. Please take a moment at the conclusion of our presentation to give us your feedback. We really appreciate it. Next slide, please. With that, we want to move forward into our very robust agenda and hear from Dr. Tom Bu on clinical guidance. So, Dr. Bu, when you are ready, please begin.
Good afternoon, everyone. This is Tom Bu, California Department of Public Health. So as everyone probably knows, adolescents 12 to 15 years old, as well as the 16 and 17-year-olds are now eligible for the Pfizer COVID vaccine. And last data I saw was that over 400,000 12 to 15-year-olds have already received their first dose. And as you probably also know, in addition to the FDA emergency use authorization, the Advisory Committee on Immunization Practices and the Western State Scientific Safety Review Work Group have voted to recommend Pfizer for all people 12 and up in California and the United States. Next slide, please. So thanks for joining us tonight. And we do want medical providers, people who take care of kids in particular, but basically all medical providers to enroll as COVID-19 vaccination providers. We're through the period of mass vaccination. We've vaccinated the majority of people who are queued up to do so, and there's a lot more people who are candidates for vaccination who would benefit from vaccination, but who will rely on their healthcare providers' recommendations for that. So we should all, as medical providers, clearly recommend COVID immunization to our patients. And we are here tonight because we're hoping to help you, convince you as medical providers, as doctors and advanced practice practitioners to enroll as COVID-19 vaccinators. The reason why it's so important for medical providers to be involved is because of the trust that our patients have in us, and also just the constant issues of continuity of care. It's better to get all medical services in one medical home. And this is thought to be particularly important in children. Many parents are nervous about this new technology, this new vaccine, and they need to hear from their pediatrician, family docs, or APP about the safety and advisability of the vaccine. And the barriers to enrollment are decreasing, although I'll be the first to admit they have not been eliminated. We all look forward to a time, sometime in hopefully the not too distant future, when COVID-19 vaccination is treated essentially the same as all other vaccines. Next slide, please. So just a few clinical considerations for adolescent vaccination. As you may know, the dose is the same for kids 12 and up as it is for adults. It's a 0.3 milliliter dose. It's a 2-dose series, 21 days apart. We are talking about Pfizer here specifically. You may have heard that Moderna will be seeking FDA authorization in coming weeks, but right now Pfizer is the only one approved for this population. There is some information CDC is disseminating about increased risk of fainting with administration of any injection being higher in adolescents. And so procedures should be in place to avoid injury from fainting, just having a place for a kid who's feeling faint to lie down. Parents and guardians are encouraged to enroll their adolescents in the VSafe program. That's an online text communication program with CDC, and to report any side effects to CDC that way. Importantly, I hope that everyone knows that the recommendations against co-administration of other vaccines with the COVID-19 vaccine have been removed. That's CDC and I believe ACIP recommendation. There's no longer any recommendation to avoid administration within 14 days. And to accommodate the increased number of small vaccine recipients, a larger number of 1-inch needles are being provided in the ancillary kits from the federal government, from the manufacturer. And 1-inch needles are preferred to ensure intramuscular administration. 5/8-inch needles would be fine with a thin child and proper technique, but 1-inch is preferred in this population. Next slide, please. So hot topic here, safety issue that's being monitored closely, but you may have seen in the media that there are some reports of myocarditis after vaccination, particularly in adolescents and young adults. CDC and health departments are investigating a fairly small number of case reports of myocarditis, which appears to be universally mild and short in duration in young vaccine recipients. It's actually still unclear at this point whether these cases, which are vaccine associated, are vaccine attributable, and investigation is ongoing. VAERS and VSafe and all the other vaccine safety data monitoring programs are watching this very closely. And there are communications to healthcare providers in many states and from the CDC going out to just raise awareness so that practitioners watch for kids with chest pain and consider the possibility of it being myocarditis. And so after a review of the available data to this point, there have been no changes in recommendations by CDC, ACIP, AAP, or our department to, there's still a strong recommendation to immunize all people who are eligible for vaccination. It's a situation we'll be following closely and communicating with the public and the providers in the state. Next slide, please. Touched on this already, but basically just reiterating that there is no longer any recommendation to avoid co-administration, and this is particularly important as we consider the many children in this population who are known to be behind on their routine vaccine preventable disease immunizations due to the pandemic and other reasons. So we hope that that providers around the state will be helping our kids catch up on their immunizations along with COVID-19 vaccination. Next slide, please. And again, just to hit this again, the American Academy of Pediatrics also now publicly and strongly supports the co-administration of routine childhood and adolescent immunizations with COVID-19 vaccines. And we nationwide, I think there are efforts to encourage families and providers of child medical care to catch up on immunizations now, get COVID vaccination now, and to avoid the usual back to school rush. Next slide, please. So CDPH, the state health department, does have some guidance for minor consent, and it's similar to other vaccinations for non-emancipated minors. It is expected that kids under 18 will have a parent or a guardian present with them, but if there is if no one present, then written consent is acceptable. And a new twist on this is that phone or video consent is also possible, but the person obtaining consent must verify that the parent or guardian has been provided with the Pfizer emergency use authorization fact sheet. Again, there is no vaccine information sheet at this point because this vaccine is available under an EUA from the FDA, so they should be provided with the EUA fact sheet. Next slide, please. And this is just simply some more information about the consent, and the state has developed a sample consent form, which is downloadable and may be used if you wish, if a parent is not present. Next slide, please.
Thank you, Tom. We really appreciate your preparation and all the important updates that you provided. And as we move on, please remember to use that question pane to put your questions in for any of our panelists or subject matter experts. We'll move on to next steps with Nisha Gandhi. Nisha?
Thank you, Leslie. Just making sure you can hear me.
Yes, we can.
Thank you. Good evening, everyone. So I'm going to spend the next few minutes talking about what comes after provider enrollment. Last 2 weeks ago, we presented the steps of enrollment, and the steps are listed here on the slide. And we are at a point where many of you have started the enrollment process and have gone through all the different steps, have started, have come into MyCAVax, have started the enrollment. And now you're at a place where the enrollment is submitted and you're waiting for us to approve your actual enrollment. So let's talk about what happens after that. Next slide, please. So once a provider is approved, you will receive an email describing the COVID-19 program details. So I cannot stress enough the importance of keeping a close eye on the emails that come out from the program. There are many, many communications that come out on a whole host of topics. But the very first one that you will get will sort of detail the description and the overall details of the program. You will also now have the option to update any account information in MyCAVAX. So for example, if your vaccine coordinator has changed, you'll be able to go in and change that information. You'll be able to update storage equipment that you have. All of these pieces of information that are in your account can be updated as needed from here on out. You'll also begin to receive information on Vaccine Finder at the organization level, and I will hold off on talking about Vaccine Finder for Kate, who will describe some of those activities. Next slide, please. Can you back up one, Michael? I think we skipped this slide. Maybe not. Okay, my apologies. Next slide. So let's talk about the vaccine that is available at this time. And it is Pfizer, and Dr. Boo mentioned it. So Pfizer does have a minimum order right now of 1,170 doses. So that is the increment in which the vaccine can be ordered in MyCAVAX. Coming soon, though, we will be seeing incremental ordering of 450 doses for smaller providers. There is a catch, and part of that is that we won't have even 50% of our Pfizer orders in this smaller minimum dose tray. So we'll only, about a third of our allocation, or what we receive from CDC, will fall into this 450 doses. So it means that we will be watching the orders as they come in and carefully review them to figure out who should be getting the 450 dose trays. Next slide, please. So vaccine ordering, and now that you're an approved provider in the system, when you go back into MyCAVAX, what you'll notice is that there's an order request page. So with this order request page, you'll be able to now go in and start placing your request. So MyCAVAX is the ordering system for most enrolled providers. You'll be able to submit your order requests weekly. As mentioned in the previous slide, right now the increments are 1,170 doses for Pfizer. Many of you have probably heard in the news that Moderna is testing their vaccine on the younger group, and that we should probably, we might have Moderna available for the 12 to 18-year-olds in the upcoming weeks. But until that time, what we do have is the Pfizer vaccine. We are looking at coordinating smaller orders through your local health department. So it is still through what is called as a redistribution. When you go into MyCAVAX, not only will you be placing your order request, you'll also report number of doses administered and on-hand inventory with your request. So this is the information that you'll enter in every time you place an order request. Once those order requests have come in, have been submitted by you, the health department and the third-party administrator will approve most requests as they're submitted. So we'll take a look at them. They'll go through a couple of our processes here. And then once an order is approved, it is then transmitted to CDC, who will then take the order, and it'll then be ready for shipment to a provider. When that order is approved by us, you will receive an email communication. So I can't, again, as I mentioned earlier, I can't stress enough the importance of keeping an eye on your emails. So you'll see the email confirmations as they come out and as we process orders, because we do process orders in bulk, and so the email communications will all go out to providers. Next slide, please.
Thank you, Nisha. And we will move on to Kate McHugh with storage and handling of the Pfizer COVID-19 vaccine. We appreciate your questions that are coming in. Please feel free to continue as we move on. Kate, when you're ready.
Hi, Leslie. Thank you. Next slide, please. So there are a few things that providers agree to when they agree to be a COVID-19 vaccination provider, and these are outlined in the CDC provider agreement. So providers agree to store and handle COVID-19 vaccines in accordance with the EUA, manufacturing guidance, and CDC's vaccine storage and handling toolkit. That toolkit is referenced in most of our materials. It's a really good reference for anyone who's getting started out in the vaccine world. So if you need to know pretty much anything about vaccine storage and handling, it'll give you all of the good guidelines that you should follow. You are also asked to monitor and comply with COVID-19 vaccine expiration dates. So it's really important to make sure you're regularly checking those and quarantining or disposing of vaccine that may have expired. You are also agreeing to monitor and comply with vaccine storage temperature parameters as required by the manufacturer. You are agreeing to use labels or an alternate method to mark thaw time and beyond use dates on vaccine vials after thawing or mixing with diluent. This is important because not all of the COVID vaccines are in the refrigerator, which we'll talk about a little bit later. So when you change the storage temperature that they're at, they do have a beyond use date that will be sooner than the expiration date. So it is important to closely track the beyond use date or time of your vaccines. And then it's also necessary to report all non-viable vaccines daily and comply with guidance for disposal. And we have some links in these slides to different links on our EZIZ website as well as CDC to give you more information. Next slide, please. And we're going to go over Pfizer a little bit because it's the vaccine that's currently authorized for use in children 17 and under. So the Pfizer vaccine is a 6-dose vial and it's reconstituted with 1.8 milliliters of diluent. That diluent is normal saline and it is provided by the federal government. So they will provide vials of normal saline and ancillary kits. So you won't have to worry about getting normal saline. It must be used within 6 hours of reconstitution. This is for sterility reasons. Once you puncture that vial, it is important to use it within 6 hours. These vials do not have preservatives, so you do need to use them somewhat quickly according to the manufacturer guidance. It is a 2-dose regimen at 21 days plus or minus 4 days. And then I'm sure everyone's heard a lot about the Pfizer storage in the news because it does sound a little bit scary with the ultra low temperatures, but it's really not that bad. And we'll go over that a little bit more on the next slide. But it is recommended for long-term storage to store it at ultra low temperatures, which that is negative 60 Celsius to negative 80 Celsius. And when you do that, you can store it for until the published expiration date, which would be about 6 or 7 months. You can also store it in standard frozen storage. So that would be your normal freezer that you might already have at your clinic. And that's negative 25 Celsius to negative 15 Celsius for up to 14 days. And then you can store it in the refrigerator at 2 Celsius to 8 Celsius for up to 1 month or 31 days. And that is new. So you might see some guidance that talks about only being able to store it for 5 days in the refrigerator, but as of last week, I think you can store it for up to 31 days. So that's very helpful for smaller practices. Next slide, please. And it is possible to store the Pfizer vaccine if you do not have an ultra-low freezer. And there are several options you can do to store the vaccine if you don't have an ultra-low freezer. So if you do have an ultra-low freezer, it's easy. You can just put it in that freezer and store it until the expiration date. But otherwise, the federal government and Pfizer did come up with an option for storing the vaccine in the thermal shipper. So the thermal shipper is the shipper that you receive the vaccine in, and it's cooled by dry ice pellets. So when you receive that shipper, you do have an option to recharge it. So you would recharge it on the day you get it, and then every 5 days after with dry ice pellets and you can store it in that shipper for up to 30 days. You technically could store it longer. It's not like the shipper expires, but Pfizer and CDC do ask that it's returned within 30 days. So that's important to make sure you're complying with that. And so if you do have the thermal shipper and access to dry ice, which most places in California, you will have access to dry ice pellets. There are quite a few vendors out there who sell dry ice pellets. You can store it in that thermal shipper. And then after the 30 days, you can move it to your standard freezer for 14 days, and then to your refrigerator for 31 days, for a total of 75 days of storage, which is quite a long time. If you only have a standard freezer and refrigerator and don't have access to dry ice pellets, or you don't feel comfortable or don't want to use the thermal shipper to store the vaccine, you can store it in a standard freezer and refrigerator for a total of up to 45 days. So your standard freezer is the one we talked about on the last slide. That's -25 to -15 Celsius. Most practices won't only have a standard freezer, but if you do happen to only have a standard freezer to store vaccine, then you could store it for a total of 14 days. And if you only have a refrigerator, you can still store the vaccine for up to 31 days. And you could also do a mix of this, like if you only have the thermal shipper and the refrigerator, you could just go straight from the shipper to the refrigerator. So there are a few options, but it's definitely possible to store the vaccine without an ultra-low freezer. And the dry ice recharge, you do need to pay a little bit of attention to what you're doing and making sure you're recharging every 5 days. But I've heard from providers it's not too bad to do, and it's fairly easy to recharge. Next slide, please. And so it is really important to make sure you're monitoring the temperature of your vaccine. Vaccines are more sensitive to temperature changes than other pharmaceuticals, so it is really important to monitor the temperature of your vaccine with a digital data logger. That is a thermometer that will store and record the temperature of your vaccine continuously. So you'll be able to go back and look at your records if you have any issues with your vaccine, if your fridge went out of range, or if for any reason you need to go back in the future and look at your temperature records, you will be able to go back and look at those records if you have a digital data logger. And the enrollment team will ask for information about your digital data logger during the enrollment process. So for daily tasks for temperature monitoring, you'll want to read the current minimum and maximum temperature on your refrigerator or freezers twice per day, when the clinic opens and before it closes. Even if you are using a digital data logger, it is important to manually go and take a look at those temperatures. You can document those temperatures on your temperature logs and keep that log printed on the outside of your refrigerator for easy access. We have here linked a temperature log that you can use. And it is important to make sure to document and record any temperature excursions, which we'll talk about a little bit on the next slide. And for biweekly tasks, it's recommended that a supervisor of the clinic review, certify, and sign that the temperatures were recorded twice daily and any corrective actions were taken. It's also important to download and review the data files from your data logger at the end of every 2-week reporting period to look for any missed excursions or temperature trends that might indicate performance issues with your vaccine storage units. So sometimes you'll be able to look at those records and notice that your fridge or refrigerator is fluctuating a lot, which might be a sign you need to get it maintained before it just completely dies out or something. And it is important to note that you do need to save your temperature logs and digital data log records for 3 years, and that is outlined in the CDC provider agreement. Next slide, please. And for temperature excursions, most temperature excursions we've seen happen during transport. So they do happen sometimes in the clinic because a refrigerator, it might just die, or there might be a power outage, or something else might go wrong. But in general, most of the excursions we've seen do happen during transport. So if you do happen to transport vaccine, it's really important to closely follow transport guidance in the CDC storage and handling toolkit. During transport and storage, it is important to make sure you're using that data logger that we just talked about, because you will need the records from that data logger to determine viability. So you're able to go and use either the manufacturer websites or directly contact the manufacturers to ask them to help you determine if the vaccine's still okay after a temperature excursion. It's really important to note that you should never refreeze thawed vaccine. If you experience an excursion and the vaccine thawed, just place it into the refrigerator because that is one of the things that will usually make the manufacturer say you can't use it if it did thaw and then refreeze again. And it's really important to remember to never transport vaccine on dry ice, as this will make the vaccine too cold. The one exception would be transporting the Pfizer vaccine that you already have stored in the original thermal shipper and you're just picking up that shipper and moving it. But otherwise, it's important to use vaccine transport containers that are either normal, refrigerated, or frozen temperatures. Next slide, please. And there is a lot of information to think about when you're thinking about your vaccine management and all the protocols and procedures you need to follow. So we do recommend that providers develop your own location-specific COVID-19 vaccine management plan, and that should be kept in an accessible place for all staff to access in case of an emergency. We do have a template that you guys can use to develop your own plans, and that will include staff roles and contact information, emergency contact information for your utilities company, your maintenance for the refrigerators or freezers if you need to call someone from those companies, and for your data loggers, and etc. It also will include storage unit information and data logger calibration information. It will include roles, responsibilities, as well as daily, weekly, or monthly tasks to help you remember all the different tasks you're expected to do, as well as reporting requirements. And it will include information on an emergency plan because, especially in California with the public safety power shutoffs, it is important to know what to do with your vaccine in case there is some sort of an emergency or you lose power, so you have an idea of what to do with it. And it also will include a few other details as well. And that's the end of the storage and handling part of the presentation.
Thank you so much, Kate. And we will move right into our next presenter, Claudia Aguiluz, on next steps after ordering. Claudia?
Leslie, thank you very much. Good evening, everyone. So what I wanted to do is cover a number of steps that happens after you have placed your initial vaccine order, and focusing on vaccine shipments, focusing on inventory management, and how to prepare your practice for the actual immunizations and patient visits. You are not new to immunization services in receiving vaccine shipments, but what we wanted to do is highlight key things specific to COVID vaccine and vaccine orders. And the first thing is talk about shipments. We will keep you abreast of every step of the way after you place your vaccine orders. You will receive a number of system notifications. Once your order is approved in MyCAVax, you will receive a notification. Once Pfizer receives your vaccine order, you will receive a notification. And once your vaccine ships, you will also receive a notification. So we'll keep you informed every step of the way. But in order for this to be successful, we want to make sure that your information in MyCAVax is updated, that we have the right contacts in the system and the right email information so that you receive those emails. And then making sure that you whitelist all of these emails so that you are able to receive them and not going into your spam boxes, inboxes. Keeping your practice hours updated certainly is going to be a key activity for the successful receipt of your shipment. And then, of course, staff training. Receiving Pfizer shipments is a little bit different. We have highlighted one of the many resources that we have available for you. And this is a really nice checklist that Pfizer has put together for providers. And really will outline the steps for you to figure out how to open the shipments, be aware of what's in there to help you open the vaccine with dry ice and have the proper precautions when you're opening the shipment. Certainly having your staff be familiar with how to receive the shipments ahead of time and even watch some of the wonderful trainings and videos that Pfizer has available is something that we're strongly encouraging your practice to take advantage of. Once your shipments arrive, it would be very important to make sure that everybody's trained on properly inspecting your vaccine shipments and your ancillary kits as well, just making sure that you have received the proper number of doses and ancillary kits, that you store the product immediately, your vaccines, and that if there are any issues with the shipments, that you report those right away via MyCAVax. Also making sure that staff are properly trained on the equipment, temperature monitoring, and entering receipts of doses in MyCAVax. Particularly if you are receiving orders from your local health department, they are going to be guiding you on how to enter the receipt of doses in the system. And then the Pfizer shippers will come with a data logger that will track vaccine shipments and temperature during transit. So it would be very helpful to have staff trained on how to properly stop those data loggers. Otherwise, you will be getting alerts and notifications at all hours of the night, letting you know about shipper temperatures. So really getting your staff familiar with how to receive the shipments is something that we're really strongly encouraging your staff to add as a key step in receiving your shipment. The next slide has how to properly manage your vaccine shipments. Actually, this is before we go there, ancillary kits. So every vaccine order that is placed will come with a corresponding ancillary kit. A federally supplied kit will contain the diluent for your Pfizer vaccine. It will include needles, syringes, alcohol prep pads, vaccination cards, and a small quantity of PPE to help you support immunizations for the equal number of doses that you have placed. You do not need to place an ancillary kit order. We will go ahead and automatically add that to your order, and it will arrive from McKesson. That ancillary kit will not ship from Pfizer, but will ship from McKesson. So we'll have you covered with supply. Let's go to the next slide, please. Okay, inventory management would be the next key activity that you would definitely want to highlight with your staff. And most of you are familiar with inventory management activities either weekly or right when you are placing a monthly order. With the COVID vaccines, you will be doing inventory reporting and management daily. As Kate mentioned, that is part of participation requirements. So we want to make sure that your clinic is prepared to do that. Inventory expiration tracking is another area that we wanted to highlight. Most pediatric or adolescent vaccines really have a long expiry date, but with COVID vaccines, this is really an active task, making sure that you are tracking beyond use dates. And we are highlighting an image, but once again, Pfizer has labels to help your clinic document the date and the use by date, so that when you are receiving doses from your local health department or where vaccines are moved from a different storage or vials are punctured, that the expiration date for that vaccine vial is clearly tracked. And then temperature monitoring, once again, I mean, it's a key activity that you do. It will be a key activity that you will do with COVID vaccines. And if there are temperature excursions that are identified, we will be asking you to contact vaccine manufacturers directly. And you will be also reporting that in MyCAVax. Waste reporting, we don't like to talk about it, but we know that there are times in which we will encounter vaccine waste inadvertently into your clinic. So I think really tracking vaccine waste and spoiling and expired vaccines, and just making sure that you have a system in place for capturing that and then reporting is something that we want to make you aware of. And transfers. You would be at times maybe transferring vaccines that may be short dated to another provider, and just properly transferring vaccines, packaging them, and also reporting those events is going to be an important activity for your staff. The next slide actually highlights 3 key systems to support these vaccine management activities in the system. And we want to highlight 3. MyTurn is one of 2 potential systems that you will be using to document vaccine administration. If you are using, if you're already enrolled in a registry, you will be reporting, or if you are using MyTurn, that would also be another system for documenting vaccine administration. MyCDX, the system that you're using to enroll and to place your orders, is also going to be the system that you are going to be used to report vaccine waste, to report any shipping incidents, to report any temperature excursion, and any transfers. So the system is really comprehensive to allow you to do everything you need and manage your inventory within the same system. And then the third system is a federal system. It's called Vaccine Finder. And this is where you will be doing your daily reporting inventory activities every day, so that you can let CDC know how many doses of COVID vaccine are on hand at your practice. And once again, this is a daily activity, but it really doesn't take much to just enter the number of doses that you have on hand. So 3 systems to help you support inventory management activities. And lastly, let's go to a number of activities we wanted to highlight in the next slide to prepare your practice to immunize your patients and get areas and protocols in place to get systems in place, to get flows in place, and to get supplies in place to administer the vaccine. The first item actually is an important for your registration team, or the team that is going to be coordinating registration. We want to highlight this item to ensure that citizenship, asking for proof of citizenship or photo ID in order to receive vaccines is something that should not happen. So just wanted to make sure that we highlight this item up front. And then secondly, make sure that your practice is prepared with supplies that you will need to distribute as part of vaccine administration, including having supplies of the EUA fact sheet to distribute to vaccine recipients. And we want to make sure that you distribute or display prominently information about the federal VSafe program. So really have that upfront and visible to patients as they're coming in. And then in terms of flow, making sure that you have the areas where you're going to be preparing your vaccines, drawing vaccines, administering vaccines, as well as the area where you're going to be observing your patients per EUA fact sheet. Reporting, making sure that folks are going to be reporting vaccine doses administered, like I said, either in the registry, in MyTurn, or your practice EHR. And making sure that you have supplies, ancillary kits. You will receive all vaccine supplies, but you may also need to be prepared with your standard supplies for potential anaphylaxis events. And in your protocols, making sure that all of your clinical protocols include steps to ensure that any report of an adverse event is reported to VAERS, CDC's Vaccine Adverse Event Reporting System. And lastly, these are areas towards the end of the visit, and making sure that that critical second appointment, it is done before that patient leaves that your practice, if applicable, if the second doses are needed, and provide that vaccination card. And a tip is to encourage recipients to take a picture of it, just in case it gets misplaced. And lastly, as patients are exiting or after vaccine receipt, encouraging them to register for the VSafe program for appointment reminders as well is a strongly recommended activity. Leslie, I think those are our key activities we want to highlight for today.
Thank you so much. We'll move right on to Mark Lane, Director of Center for Economic Services with CMA. Mark, please go ahead with billing and reimbursement.
Thank you, Leslie. Can you hear me fine?
Yes, we can.
Oh, excellent. All right, well, let's take a few minutes just to do a quick review of billing and reimbursement with vaccine administration. So here's some general information or bullet points of things that we think are important for providers to remember. Obviously, the federal government's purchased hundreds of millions of these COVID vaccine doses, and they're providing them free of charge at this point. So there's no billing or reimbursement for the vaccine itself for the foreseeable future anyway. Physicians are reimbursed for the vaccine administration, so you do get paid for that. Physicians participating in the vaccination program agree to administer the vaccine regardless of the patient's ability to pay for it or whether they have insurance coverage. Both public and private payers are required to cover the vaccine administration with no patient cost share, so nothing to the patient. And physicians shouldn't be seeking reimbursement for supplies such as PPE or cleaning supplies related to the vaccine administration. That's what the administration charge will pay for. And if a patient is seen who is uninsured or without coverage, the provider can seek compensation through the Provider Relief Fund. Next slide, please. Here you'll see some CPT coding guidelines. The codes are listed. This is a summary of what the Center for Disease Control and Prevention put together with the CPT editorial panel. And these are representative of the 3 approved emergency authorized vaccines. You'll see that the vaccine serum is indicated, and for the Pfizer and Moderna vaccines, there is a first administration code and a second administration code. That obviously will help with tracking and allocation and distribution of the vaccines as we go forward. Also, again, the federal government supplying the vaccine, no reason to build the vaccine code at this point, but obviously there is a code dedicated to it for future usage. Next slide, please. While this slide is for informational purposes only, this is a Medicare summary, and you may not have patients that are involved in this, but in the event you do, Medicare fee-for-service and Medicare Advantage plans have vaccine administration carved out to the Medicare fee-for-service system. So ultimately, that means that the Medicare fee-for-service system will pay for the administration through Noridian, the Medicare administrative contractor for California. No patient cost share is applicable. Claims would need to be billed under the patient's original Medicare ID and not the Medicare Advantage ID number. Again, don't bill the vaccine, only bill the administration code. And in mid-March, the reimbursement for the administration code was increased to $40 per dose. Next slide, please. For Medi-Cal, DHCS, the California Department of Healthcare Services, announced that it would carve out the COVID-19 vaccine administration, again, out of the Medi-Cal managed care system and reimburse it under the Medi-Cal fee-for-service delivery system, similar to what Medicare did. So claims for Medi-Cal vaccine administration go through the Medi-Cal fee-for-service system. Reimbursement for the vaccine administration would be at the Medicare rate, no patient cost share, and submission of the claim to Medi-Cal must be billed under the beneficiary's Medi-Cal benefit ID number, not the Medi-Cal managed care number. No billing for the vaccine. And as Medicare did, the administration reimbursement was up to $40 in mid-March as well. Providers that are not enrolled in the Medi-Cal system but do see a patient would need to enroll through the streamlined emergency Medi-Cal enrollment process. I think it's called PAVE, to avoid unnecessary claim denials. Next slide, please. For commercial health plans and insurers, the California Department of Managed Healthcare issued an all-plan letter and an FAQ instructing health plans on their responsibility to cover vaccine administration. The guidance says that health plans must cover vaccine administration with no patient cost sharing. Also, plans must provide coverage regardless of whether the enrollee receives the vaccine from an in-network or an out-of-network provider. The administration claims must be submitted to the plan or the delegated group, the medical group, as you would normally do with other vaccines, unless you are instructed otherwise. And we would typically say visit the plan or the plan or the delegated entity's website to determine if there's other information that would direct you elsewhere. Also, just so you're aware, health plans cannot automatically delegate the financial responsibility of the administration codes to the medical group or delegated entity without that group approving or accepting that. So it allows the delegated group an opportunity to remedy any kind of financial stress or distress they may receive because of the number of vaccine administrations they have to pay for. In-network providers are reimbursed at the contracted rate, and out-of-network providers are reimbursed at a reasonable rate, which CMS suggests is the $40 rate now. Next slide, please. Under the CARES Act, self-funded plans are required to reimburse for the COVID vaccine administration codes with no patient cost share for either in-network or out-of-network providers during the national public health emergency. So again, no patient cost share for in-network or out-of-network providers. And physicians who provide vaccine administrations to uninsured patients will be reimbursed through the Provider Relief Fund administered by the U.S. Health Resources and Services Administration. There's more information on their website, which tells you how to apply and how to be compensated. Leslie, back to you.
Thank you so much, Mark. We'll hear from Eric Norton for a My Turn overview. Eric?
Good evening. Again, yes, my name is Eric Norton. I am the project manager for the My Turn system for the state of California. My Turn is the state's vaccine scheduling tool that many people know about. But as Claudia mentioned earlier, it's also a purpose-built clinic tool as well that's available for use for the pediatric vaccination. So what I want to do here is talk a little bit about just the functions and features of the My Turn clinic functionality. And then I'll have a quick conversation about some of the options and when you would want to use it or what other avenues you have available to yourself. So again, My Turn as a clinic, it offers multiple pieces of functionality. There are types of clinics that you can have. 3 types that we typically go with. One is a walk-in, so no one needs to be scheduled for it. They can just, as it states, walk in and get vaccinated and get that information entered into the system. That's a convenient way we envision that pediatric vaccinators could vaccinate family members, or also, again, if your EHR doesn't report to the state's immunization information systems, to use that walk-in as well. But you can also set it up as a scheduled clinic as well. So if you want to have slots that are available that your individuals can schedule through, you can put it up as a scheduled clinic, and they'll find those times that are available and book those. And then finally, there's a coded clinic, and we're using those where if you just want to kind of block off the clinic so that only people who have an access code can see it, we can set that up for you as well. So there's multiple ways we're setting these up. As far as general features, one of the key features of the system is that it has automated dose reporting, so you don't have to go and enter information and then enter it again in care. It goes straight into care, SDIR, and RIDE as well, so that you're not having to manage that, and it goes in hourly. We also have user account management, capturing the patient information, and then, as we mentioned in the other column, the ability to manage appointments and then receive and send SMS appointment reminders. So from a reporting side, if you're using My Turn Clinic, you have the ability to access and run clinic reports about clinic operations, appointment reports to see what's happening with regards to how you're booked for that day, patient reports, and then the other ones that are listed there as well. The other thing that's important is you have the ability to export those reports. So if you're seeing people in My Turn Clinic, you can export those data and then use them in your own systems that you may have available to yourself as well. Finally, off to the right, just want to mention we have a separate sister system called My Turn Volunteer. And essentially what that does is that enables you, if you wish or need to have assistance in your clinic operations, you can set it up, that clinic, in My Turn Volunteer. And then individuals who have either clinical or non-clinical skills and desire to volunteer can also kind of match up with that as well. Next slide, please. All right, so with regards to how and when you would use My Turn, there are a couple options you have available to yourself. Again, what we're looking at here is, there we go. Okay, so what we see here is that, at the top you see requirement, submit vaccination information to the records to the state's IIS. So that's an overriding, overarching requirement. You have to do that. If you can't do that, then there's we have to walk through some of the options. So option one, you have an EHR, a medical record system, that is able to send data to care for both the child and the parent. In that case, you have just continue using the EHR as you have planned before. And then also, if your EHR does not submit to the IAS, and this is, there's some nuances on here. One is that the EHR is able to send option two, the data to care for the child, but then not for the parent. What we'd recommend you do at that point is to, if you're vaccinating parents or people not inside of your system, that you would set up a walk-in clinic. It's the easiest way to do it. And then as people come through your system or come through and you're vaccinating the children, you can also get the parents or the guardians who are there with them as well. And we, if you see, we have the double asterisk there. We have a full service support team that's able to set those up for you and walk you through it. There's the request and the email address down there for vaccinenetwork@cmadocs.org that enables you to reach out to them and help set that up. There's a process that goes along with that as well, but again, that's why we have the team that can help you with that. Option three is that you don't have an EHR, and you at that point you would be using MyTurn for both the parent and the children. And similar to the other option where you're using it, you would set up MyTurn as a walk-in clinic, and then again that would record the vaccination and send that information over to the IAS, and we would help set that up with you. And then finally, optional on the right-hand side, you could have an open to the public clinic if you wanted to set that up. Again, our team, both with the CMA and with our own MyTurn support team and our turnkey support, will help you through those options if that's something you choose to do. Next slide.
Thank you so much, Eric, and to all our presenters. We are moving on to resources. Next slide, please. We want you to be informed as prospective providers or current providers. Many resources can be found on eziz.org/COVID, and you can see highlighted in red the column with many updates, enrollment, onboarding, management, administration, requirements, communication, and further resources such as phone numbers and emails are available to you. Please take a look at that site. Next slide, please. We also want to highlight that on eziz.org/COVID, you can find provider FAQs. The link is located on the bottom of this slide, and it is updated weekly, now in its 20th iteration, and includes pediatric provider FAQs, some of which are highlighted here. So please do take a look, download, and use that and share with those who can benefit. Next slide, please. We also have training and resources available on MyCAVax through their 101 trainings. Wednesday, May 26th from 10 to 11 a.m. There is a link here to join along with the password, and they'll be covering these topics on the left-hand side, such as product and program training, next steps to enrollment, readiness checklist, vaccine management, administration, and reporting at a glance. So please do participate. Next slide. And we do have a CMA toolkit available through their vaccine administration resources. There is an insurer's toolkit, a vaccine toolkit for medical practices, Medi-Cal response web pages available, and many other resources and phone numbers for you to call should you have any needs. So please do take advantage of that CMA resource. Next slide, please. And we also have educational materials for parents and patients. We list many different links here to the Vaccinate All 58 Communications Toolkit. This includes multilingual resources and simplified literacy resources for communicating between provider and patient. There are flyers that you can download and post, and fact sheets. So please do make use of those links. Why reinvent the wheel when they've been invented and created for your use? So as you become a pediatric adolescent provider, please do make use of all the many resources. We want to support you in your efforts as you enter in. Next slide, please. And where can I go for support? We have phone numbers, emails, and hours of operation for the provider call center, CMA enrollment support, MyCAVAX help desk, and the My Turn clinic help desk. So do take advantage and call, email, ask any question or make any comments, and those folks will be taking in your feedback and questions. Next slide, please. We want to get right into Q&A, and to help me facilitate the Q&A this evening, I'm going to be passing the microphone to Jane Gray. So Jane, when you are ready.
Thank you very much, Leslie. I also wanted to let all of our participants know that we are going to extend this session a little bit so we have a chance to answer all of your questions that we've had coming in through registration and the panel. So please stick with us for another 15 minutes. First question. I am enrolled in MyCAVAX but have not yet received any vaccine. When can I expect to get it?
Hi, Jane. This is Nisha, and we do know that there are many providers who enrolled early in the process, weeks, some even months ago, and that have not received vaccine, and that we were dealing with at one time, a very tight and limited vaccine supply, along with a prioritization plan in place. But since then, especially in the past few weeks, we've seen vaccine supply really loosen up, and that we do anticipate over the next few weeks, as we do make some systems changes as well, being able to provide vaccines to providers who still want them.
Thank you. Are there any rules for redistributing vaccines between multiple clinics? And related to this, can practices share orders? Claudia, can you answer that for us?
Thank you, Jane. So yes, there are rules for routine redistribution of vaccines. And this is a process that has to be approved by CDPH. And redistribution means routinely receiving amounts of vaccine, repackaging it, and then redistributing it to other locations. This activity is primarily limited to local health departments and large, what we call multi-county entities. So routine providers actually don't have routine redistribution permissions. We know that vaccine transfers will need to happen. So if you do happen to have a need to transfer a surplus of doses because it's either short-dated or you cannot use it, then you can do in the system what's called an emergency transfer. But this is an event that is a one-time, it's limited, and it's not a routine activity. Once again, if you are enrolling in the program, if you are saying that you would like to be a redistributor, there are a number of documentations and a secondary agreement that needs to be signed, and then CDPH will review and approve that. And you will know if you have approval to routinely redistribute vaccines. And as far as sharing vaccines, I think we want vaccines to go directly to locations, or a local health department will be giving you vaccines to go directly to those locations.
Thank you very much, Claudia. I believe this question is for Kate. When you say standard freezer and refrigerator, are there any stipulations on what kind? Is it okay if it's not pharmacy grade?
Yes, it is okay if it's not pharmacy grade. During the enrollment process, the enrollment team will look at what units you're planning on storing vaccine, and they'll double check that it's okay for vaccine to be stored in it. But it could be like a household grade standalone freezer or refrigerator. The one thing that is definitely not allowed would be dormitory style refrigerators, but it is possible to store vaccine in a non-pharmacy grade unit.
Thank you. Once the clinic is enrolled, how soon should they expect to start administering COVID vaccine? And related to that, how long does it take between ordering and delivery? Nisha?
Yes. So we are, as I mentioned earlier, updating our system now to get things in place to allow providers to place their order requests. And then we don't anticipate much of a delay when an order is placed and reviewed, but I can't give you a definite timeline just yet, as we are currently really updating our systems, and we should have more information in the next couple of weeks in terms of how long it'll take from you placing an order request to you receiving an email confirmation that the number of doses that you have a shipment coming. So the second question had to do with when an order is placed and delivery. And I'm going to ask Claudia to confirm if I'm right, but when we upload orders daily, and once the orders are uploaded into the CDC system, I believe they are also sent to Pfizer, and that Pfizer vaccine is delivered within 48 hours of that order going into CDC. Claudia, please correct me if I'm wrong.
That is true. That is the rule of thumb for delivery for Pfizer.
So as I mentioned before, the email confirmations are really key because that will give you your window that will start the clock for when vaccine will be delivered.
Thank you very much. How is it determined which providers fall under individual practitioners and small practices and do not have to participate with the TPA? And might that include a small hospital in a local health jurisdiction?
I'm not sure we have the answer to that yet. Do we, Nisha, Claudia?
So yes, I think Tom is right. We are currently working through those definitions, actively working with the TPA to be able to categorize those providers and to be able to identify them in the system. So we are, as we're modifying our system, we really are working to get those definitions, which are in the works as we speak.
Can all who've completed Section B in the enrollment start vaccinating regardless of TPA status now?
So if they are an approved provider, so Section B has been completed and is approved, and you are able to get doses either from the local health department or from a direct delivery, then yes, you can go ahead and start vaccinating.
Thank you. How do we order vaccines with an amount that matches the capacity of a small practice? And when will the smaller trays be available?
So I will start with the second one. The smaller trays, which I think are the 450 dose trays, we are expecting in the next couple of weeks. I believe June 1st is when the trays are supposed to be available. So I might be wrong about that, but it is around the corner. The first question had to do with how to order the right amount of vaccine for a small provider. Is that how the question was worded?
I think it's about the redistribution, the smaller amounts.
Okay.
Yeah.
Mm-hmm. So so remember, the order requests are done weekly. So we would want you to estimate how many patients you can vaccinate in a week. We are working on updating the order request process so that way anything less than the 1170 or 450 requests can come in. That has not been, it's not in the system yet, but we do expect that to be made available in the next few weeks.
And if I may,
Thank you.
Nisha, as well. So I think as you are enrolling in the system, we're also working really closely with your local health departments on sharing enrollment information. As more enrollments are coming in, I think what we're going to do is implement a routine reporting of new enrollments so that they are also connecting with you. I think most small providers are going to be coordinating with the local health departments for the receipt of doses through the redistribution until our system is able to take small quantity orders to be able to send those directly to them. So I think we're working on a couple parallel tracks, getting our system ready to take small orders. But in the interim, I think you would also be working really closely with your local health department to get small quantities if you are not able to place the 450 or the 1170 of Pfizer in the system directly.
And thanks, Claudia. And if I could just add that I suspect that the speed, the rapidity with which LHDs can begin to accommodate these smaller orders is going to vary some. I think there are some health departments around the state that are, doing it now, ready to do it now. They can accommodate, large number of providers with, without breaking stride. But in other jurisdictions where this is a new undertaking and maybe, many more providers, it might be a slower startup process.
Yes, thank you for that. It does look like we're receiving a few questions, just unsure how to estimate how many they should order, and just not sure how many a small office should start with. How many doses?
Yeah, and it's also challenging because it's a 6-dose vial, and once you reconstitute it and puncture it, as Kate said, you've only got 6 hours to use it. So, yeah, it takes some planning, some art to minimize wastage and maximize the utility.
Jane, I think we talked about My Turn, which actually is a really great tool for scheduling, but we also talked about that vaccine orders are going to be placed weekly. So I think I want to just put that in your mind that I think we're talking about small amounts. We're talking about weekly. We're also talking about your appointment capacity. So really looking at your forecasted of number of appointments that you can support, and then look at that for placing a weekly amount is kind of what we're looking for. I think we have to keep reminding ourselves that I think we may be used to quarterly orders or like monthly orders, and in the world of COVID, we are dealing with weekly amounts. So maybe start estimating, your throughput, what you can do in approximately a week, and then your appointment capacity. I think would be something that could help determine how many doses to order. And your local health departments will also help you, walk you through that as well. I think that's one thing that they are amazing at. There are, and you can also reach us to try and determine that. We can support you to try and determine how much you should place your order.
Thank you. Those are all great points and good points coming in from our participants as well. And I just think there are some concerns about consequences of wasted doses, et cetera. But I think that's something that we can work on developing some more guidance for. With that, unfortunately, we do have some questions remaining, but we do need to conclude the webinar. So I just want to remind you that we do have the frequently asked questions for providers posted on the EZIZ website. And there is a section specifically for pediatric providers, and we'll work to get as many of these questions answered there as possible. Leslie?
Thank you, Jane. And yes, indeed, we will look at your questions. As we move to the next slide, I do want to thank Jane Gray for helping facilitate the Q&A, Michael Fortunka for working through the slides, and our partners at CMA, Victoria Travis and her team. Thank you for helping us get this set up and running. Special thanks to today's presenters, Tom Boo, Kate McHugh, Nisha Gandhi, Claudia Aguiluz, Eric Norton, and Mark Lane. We greatly appreciate your preparation and time. For content support, we'd like to thank Troy Parrish, Edgar Ednicott, and Jane Gray. And again, for the webinar support, we are so grateful for all that CMA has done to help support CDPH and our efforts to get solid information out to you, the attendees. Next slide, please. With that, we want to remind you that when today's webinar ends, you will have an automatic poll launched. Please just take a moment to fill that out. And in the meantime, most importantly, we'd like to thank you for your commitment to protect the health and well-being of all Californians. And we greatly appreciate you considering becoming a provider. And for those of you that are current providers, thank you for all your efforts to vaccinate California. And we thank you for joining today's webinar. With that, our session will conclude.